since PEMF therapy penetrates cells completely, totally, it activates mitochondria. So it increases mitophagy. It increases autophagy, and it stimulates the whole ATP cycle. So magnetic field therapy, so ATP by itself, adenosine triphosphate, is the energy molecule of the body, right? It's produced by mitochondria. So mitochondria that are poisoned or dysfunctional can't make ATP, can't make enough ATP to respond to the demand for ATP. Any inflammation is an ATP hog. It just starved for ATP. So magnetic fields increase the production of ATP from ADP, but ATP by itself is not useful.
Welcome to the PEMF Effect, where breakthrough science helps take control of your health. I'm Dr. William Pawluk, and I'm here to guide you in tapping into the power of PEMF therapy for recovery, vitality, and total body wellness. From overcoming chronic pain, optimizing brain health, boosting energy, and aging with strength, this podcast is your path to cutting-edge solutions for lifelong well-being. If you're ready to move beyond symptom management and tap into your body's natural healing ability, you're in the right place. Let's dive in. Today's episode is a previously recorded session from a summit where I was a guest speaker.
Hey everyone, welcome back to this episode of the Healing from Lyme Disease Summit. I'm your host, Dr. Tom Moorcroft, and you're in for an exceptional treat today. We get to hang out with Dr. Bill Pawluk, Dr. William Pawluk, MD, a good friend of mine that we've kind of been developing a relationship over the last several years. He is an expert and kind of the world's foremost expert in PEMF, and it's a topic that comes up so much in the treatment of Lyme disease and recovery from any kind of chronic illness, protecting your health. And we've sat down and had conversations not only about the science and the practical application in some of our sick patients, but also just broader conversations about promoting self-healing, getting back in touch with, our environment, all the things that we talk about all the time, so that we're not only connected with our internal ecosystem, we're connected to our external ecosystem. And with PEMF, it can help us when we're stuck somewhere, and even if we just want to supercharge things. So Dr. Pawluk, I'm super excited to be able to, shed some light on such a complicated topic. And I can think of no one better who knows more and can actually put it into terms that we can, both physicians and the lay public, really understand. So thank you so much for being here.
Well, thank you, Tom. I really appreciate you being here and seeing you again.
It's always so much fun because I love talking with people who we were talking right before we popped on. We're going to, at the end, we'll let you know about some of Dr. Pawluk's books and references and resources that are available to learn more about PEMF. And one of the things he was talking about is if you want to geek out, you get this book. If you want to kind of just geek out a little bit and you really want to get more practical application without the super, geek effect, you would get this other book. And so he really knows how to serve our population so well. And today I'm really excited. And, we decided we were going to talk about PEMFs and how they have 27 different actions that could help heal the ravages of Lyme disease. And so a lot of times it might augment a title of a talk or something, Bill, but I love this one. And one of the things I'd love you to maybe tell us about is what are PEMFs, and maybe tell us a little bit about your backstory, how you got into it. And then we can dive into how we can, all these different actions and how these really can be helpful in people suffering from Lyme and other things like that.
Well, thanks. My background basically is family medicine. And I was a medical director and a chief of family medicine for a big group in the New Jersey area. And we shared patients. We made rounds together as a group. And in the span of about a week, within a week, we had 2 admissions to the hospital. People were almost critically ill from GI bleeding, gastric bleeding. Common factor was ibuprofen. So I started to ask myself, this is stupid medicine. I don't have any better solutions, and narcotics are not a better solution. Surgery is not a better solution, and so on. So what could I do? So I said, okay, well, I've had this in my back pocket for a long, long time. Now I'm going to go do it, which is to go learn to do acupuncture. I studied acupuncture, and then at the end of my training, I wanted to do acupuncture, but nobody wanted to do needles. People didn't want needles. Now, they didn't understand the needles were very thin and they were not very painful, but still people didn't want needles. So I had to find a different way to do acupuncture, and I discovered magnets. And the more I worked with them, the more I became sort of enthralled about what they did. And it was not just acupuncture. That's one of the clear benefits of PEMF therapy is acupuncture. So every time you lay on a magnetic pad or mat, you're stimulating the entire acupuncture system in the body. So rather than having to figure out which needle and which point you need, or which point or which meridian you need at any given time, one of the ideas would be just treat the whole body, and the body will take care of itself.
It's one of my favorite concepts, and everyone at the summit has probably heard me say it ad nauseum, like really like support the body's self-healing mechanism. So, one of the things about this is maybe you could define for us sort of what a PEMF is. And then I think if we're going to define what that is, maybe we should also dig into what EMFs are, because I think that like we hear one as probably positive, we hear the other one as probably negative. And, if we can compare and contrast them, just so we have a good, strong jumping off point for the rest of the conversation.
Well, let's start. That's a good one. That's very important. Get the elephant out of the room right away. Right? Because this is the first thing people ask me very often. But what about EMFs? They're dangerous, etc. We hear about 5G and 7G and 10G, whatever else is coming. EMFs, which I call environmental magnetic fields. They are electromagnetic fields, but they're environmentally produced. And those environmental magnetic fields are primarily microwaves. Microwave towers, cell phones, Wi-Fi, all of that is EMF. And they're dangerous because of the fact that they're microwaves.
Mm-hmm.
And the problem with microwaves is that they get absorbed by the body. They don't pass through the body because the wavelengths are too short, so they get absorbed. And because they're absorbed, they then cause heating, which then causes DNA damage, DNA effects, and heating of tissues. So that's the purpose behind a microwave oven, right? Is to heat.
Mm-hmm.
So you're cooking things. So people who put a cell phone to their ears and hold the cell phone there, when they take it away, you can clearly see the ear's quite red, right? And the other ear is red too, but not as much as the primary ear. And so if you have a cell phone attached to your head for hours and hours at a time, we now have we know that there's an increased incidence of acoustic neuromas, and people will keep a cell phone to one side of their head all the time. But we should not be doing cell phones without the earbuds, preferably not even earbuds, preferably acoustic, just on voice.
Right, like a speakerphone, yeah.
Speakerphones or other ways of broadcasting. The tubes.
Yeah, air tube. Yeah,
air tubes, but they're not very practical. You can't hear them very well. So I just put on voice. So EMFs are broadcast into the environment. They're like radio waves and television waves and radar and sunlight and color, lights, etc. They're broadcast in the environment. So they go on forever. And they are wavelengths, like the waves in a pond. They go on forever. PEMFs are very restricted. So that's EMFs I call open loop. They go out. They don't come back. They don't close on themselves. PEMFs, on the other hand, are created by current flowing through a wire. So let's say my thumb is the line, right, the wire carrying the current. That current is then producing, with every pulse of that current is producing a magnetic field. But that magnetic field goes up and it comes down. As the current goes up, magnetic field goes up. So that magnetic field basically is collapsing on itself. It's always opening and collapsing, opening and collapsing. And the stronger the magnetic field, the bigger the stronger the current, the voltage going through that wire, the stronger the magnetic field. So you could design magnetic fields that will basically go right through the body completely.
Mm-hmm.
Because they're very long, they're not a wavelength, they're just a pulse of a magnetic field going in and out of the body. And that pulsation then creates charge in the body. So we know, doctors are aware now of, many people are now aware also of devices called TMS, transcranial magnetic stimulation, that are used for treatment-resistant depression and are FDA approved. Well, their sole purpose is to replace ECT, electroconvulsive therapy, right? And they're much safer than ECT. But their goal is to produce current in the brain. And that current then wakes things up. Now, while they think that they're only stimulating one part of the brain, left prefrontal cortex, actually that current is going through the whole brain.
Mm-hmm.
So the effects are not just in that prefrontal cortex area. The effects are through the entire brain. So the magnetic field spreads through the whole brain. The charge production spreads the whole brain. So that principle of creating charge is exactly the principle that we rely on And this is why I basically tell people that intensity matters. The intensity of the magnetic field matters because it's the intensity of the magnetic field that produces a charge in the body. So the body, and the way that charge is produced in the body is that it's interacting with all the ions and all the charged molecules of the tissues of the body. And as the magnetic field passes through those tissues, it goes all the way through without obstruction. A magnetic field is like the wind in the trees.
Mm-hmm.
It doesn't stay in the trees. It starts to move stuff, but it keeps on going. So we do the same thing with magnetic fields. They're basically creating, we know the magnetic field by its actions. So you talk about the 27 effects of PEMFs. So we know it by its actions, but what it's doing is increasing charge in the body, that charge is used by the body. So the magnetic field doesn't do the work. It's inducing charge in the body, and the body uses that increased charge then to do whatever work it wants to do. In other words, I can't dial, of those 27 actions of magnetic fields, I can't dial a single action. I can't dial circulation. I can't dial inflammation. I can't dial pain reduction. I can't dial acupuncture. Okay, the body's going to take that signal and do whatever it needs with it. And the body prioritizes what it's going to do based on what's easiest, what the magnetic field is, what the tissue is, what the pathology is. So the body makes the decisions on what it's going to do with this new energy, this activation that we've just given it. It just wakes everything up.
Are you tired of living with chronic pain? Medication only masks the symptoms, but real healing starts at the cellular level. I'm Dr. William Pawluk, the leading expert on PEMF therapy. Pulsed electromagnetic field therapy is a science-backed, drug-free solution that helps reduce pain, speed up recovery, and improve overall health, right from the comfort of your home. Take advantage of an exclusive 10% discount on drpawluk.com PEMF systems. Visit drpawluk.com, that's drpawluk.com, to register and claim your savings. This limited time offer is available only to registered listeners. Don't miss your chance to experience the benefits. Terms and conditions do apply. Don't just manage pain, transform your health. Visit drpawluk.com today and let's get started on your healing journey together.
I mean, this might be one of the reasons that I've loved it since the first moment I've been on a pad, and I actually even have one of mine right here with me because I keep it at my desk for when I'm at the desk longer than I want to, or, but it is interesting. Like a lot of, I kind of like tweaked my knee that was previously injured in sports stuff, a few weeks ago. And it's like, I put it right over it. And it's like all kinds of other stuff happens first. And then the knee kind of, even though I put it right over it. So questions that kind of come up for me is because I mean, this is one of the things that, like with stem cells, osteopathic treatment, and even like acupuncture that you mentioned, so many of our healing modalities. And I think this is so key for the people in our Lyme community, is that the body is going to take the charge, the medication, the herb, and do with it what it needs to do first. Now, certain medications in particular may target a certain area, but still we get results that we're not really expecting all the time because the body's so unique and so wise. What about, because we've talked in the past about different machines that I've had and other people have used, and what about like frequency and of the different fields or position on the body? I mean, can these help us move in a certain direction of healing, or is it just kind of like we just need to get to high intensity and make for it to work and let the body do its thing?
The problem with frequency is that every molecule in the body has a frequency. And the range of frequencies in the tissues of the body is vast. It goes up into the gigahertz range. Even the body produces radio waves as well.
Mm-hmm.
To try to figure out a frequency, when you say, okay, I'm going to pick 10 hertz and I'm going to aim this 10 hertz at a cell. Well, how many of the functions of the cell are based on 10 hertz? Very, very few. Now, there are harmonics, so there are multiple tracks for that 10 hertz to multiply itself and different effects downstream. But the thing is that 10 hertz is not the only frequency. picking the frequency, and this is one of the problems that I have with Rife machines. I think Rife machines work. That principle makes sense. That's all based on resonance. But pick the frequency. And if you look up the books on Lyme disease, for example, or you look up the books on brain injuries or cancer or other kinds of infections, there is not just one frequency. They give you a bunch of frequencies. And how are they discovered? Trial and error.
Mm-hmm.
Not by controlled research. And so what happens is that, why do you have 5 frequencies for calcium ion resonance? Because there are more than 5 frequencies for calcium. And it depends on where the calcium is, the tissue that it's in, and what it's combining itself with, and so on. So I think frequency fundamentally is way more complicated than it needs to be or can be. As a result, it's very hard to pick and be right. Now, another factor relative to frequency. So frequencies, again, like EMFs, are broadcast into the environment. So frequency is a bit like that. So every molecule, every color has a frequency. And it's an open loop, right? It basically just goes out into space. So what we're talking about then is trying to confine the frequencies, or the pulse rates, we call them, into the particular target. And so you can design, say, for example, if I do 10 hertz, let's use that as an example again. That's a very common frequency for healing. Let's say you have to go from 0 to 100. Let's say you're climbing a ladder, and it's going to take you X amount of time to climb the ladder from 0 to the peak. So let's say that time is 5 minutes, 2 minutes. Okay, and that frequency, that pulse going up to the peak of the ladder, is going to take that amount of time regardless. And so therefore, let's say that's 10 hertz, right? It's going to take 10 cycles per second to get there. Let's say I decide I'm doing 20 cycles per second. Much faster. You're not going to get to the peak. You cannot achieve the peak in that time, that short a period of time. You're having the amount of time for you to get to the peak.
Right.
And because you're having the time, then you decrease the intensity. Because the peak, the top of the ladder is the peak. That's what you're aiming for, the top of the ladder. So again, as you change the frequencies, you're changing the intensities. And so very often, I have a very hard time differentiating intensity effects from frequency effects or pulse rate effects. Is it the pulse rate that's doing the job? Or is it the intensity that's doing the job? And sometimes it's a combination of both. But there's very little research holding those values constant.
Got it.
So in other words, when you're designing magnetic field devices, there are billions of permutations and combinations, billions. So that's an impossibility for practical research. But my experience then with 30 years of doing magnetic field therapies is I have discovered that intensity makes the big difference. It's not the frequency so much.
And so it's so interesting because so many of the devices that I've kind of seen over the years either have like one setting or 8 billion, like not literally 8 billion, but essentially a minimum of 100. I'm like, what the hell one do I even use? And it's like, to me, it was always like, well, I was cranking up the intensity just because, like, you know, for each person, for what it felt like they could handle when you're in the room with them, or if they have one at home working to adjust that. When you say intensity though, like, what are you looking for? Because I mean, I know one of the reasons that so many people come to you and consult with you and your team, grab your books and such, are because you're like, no holds barred, no BS, like, here's the research, this is how it works. And when we're looking at different machines, and not to get, we don't have to get into that, you can do that on the consultation time and what to buy and what not to buy. But I mean, like, from an intensity perspective, is there a certain minimum sort of power, if you will, that your device needs to be able to create? Or should I be redefining the words?
All right. So if you take those 27 different actions, there is not enough research to say what is the optimal signal is for each of those actions. But the one I tend to work off the most is inflammation. because almost all conditions, all health conditions, including aging, are all related to inflammation. So inflammation, research has found, in fact, that 15 Gauss is a measure of magnetic field intensity, GAUSS. So 15 Gauss is the optimal magnetic field intensity to decrease inflammation. Now, this is all done by the adenosine receptor, which sits on neutrophils. And neutrophils are where?
Right.
Everywhere in the body, right? So
where are they not? Yeah.
In the cells themselves, right? So what happens then is, if the goal is to give you 15 Gauss to provide the optimal magnetic field intensity to work at the adenosine receptor, then you have to do the calculation like we do with radiation therapy. You have to calculate the dose that you're trying to deliver into that part of the tissue. So 15 Gauss would work superficially, just on the surface of the skin. But if you're going deeper into the body, the other side of the wrist, you have to then calculate the loss of the magnetic field over that distance. So a 4,000 Gauss magnetic field will drop off to 15 Gauss in 4 inches.
That's pretty interesting.
4 to 6 inches. So if you try to treat across a brain with neuroborreliosis, then you have to calculate the magnetic field intensity to be delivered on the other side of the brain. The good news is the body ignores what it doesn't need. So in other words, if you exceeded what the body needs, the body basically ignores it. So the goal then is to deliver 15 Gauss across the brain, or across a lung, or across a shoulder, or a hip, or into a belly, or a liver, heart, whatever. So you always do that calculation. And my book, Supercharge Your Health, has a table that shows you the intensities you need to deliver 15 Gauss at a distance. I also have it on a blog on my website, drpawluk.com, on adenosine, inflammation, and pain. So adenosine, inflammation, and pain. And that table then gives you the objectives for what you should be getting to target deeper into the body. Now, if all you're interested in is treating a tennis elbow, you don't need a high intensity. Right? You don't need maybe you only need, well, a minimum of 15 Gauss. Right? But if you're going, say, half an inch into the body, you're going into the tennis elbow area, that it's very superficial. So it's like within quarter inch, maybe half an inch, depending on how much of an area around that tennis elbow is involved with inflammation. So let's say you need 50 Gauss or 60 Gauss to do an adequate job of a tennis elbow. But then who doesn't need anti-inflammatory treatment in their body?
No one I've met.
That person who has a tennis elbow has a need for prevention. That person with a tennis elbow has other problems usually going on, right, as well. It's rarely just a tennis elbow problem. But they're ignoring other things because they're not interfering with their life. So they say, I don't need to worry about that. Let me just focus on the tennis elbow. So then you buy a little device like you have, which is perfect for a tennis elbow. That's 200 Gauss. So that's a nice magnetic field intensity, and it will do superficial things pretty well. But it also interacts with the acupuncture system, and it interacts with the nervous system to do other things as well, in terms of tuning the body or tuning the brain.
Yeah, I think it's interesting too, because having like a whole pad that's much stronger, or having the ability to move a smaller thing in different places and travel with it, as I do quite frequently, it's nice. And also, like, I find that you can put certain things in certain areas if you're working with a practitioner to know how to stimulate different systems in your body. I guess the other question though is, like, even just looking at your website, there's a lot of different systems out there. If I go beyond your stuff, there's even a gazillion more. And I know that you vet what you work with, which is why I use you as my primary resource on all this. And then I just go check the research, because you're just referring to the research, and which is great, which is, to me as a scientist, the most important thing. And then adding the art of the medicine on top of it, obviously, is how we treat our patients and our families. But what types of PEMF systems are kind of like the best ones to look at for healing? I mean, is there things that set one apart from the other?
Well, this is the Lyme Summit, right? So to look at Lyme disease, then when I talk to an individual with Lyme disease, I know it's a system problem.
Yep.
It's not just a heart problem or a brain problem or a skin problem or a gut problem, right? It's a system problem. So that while we want to treat a specific area that may be a particular problem, like the brain, but we still want to treat the rest of the body. Because if you don't treat the rest of the body, you have to maintain a healthy body for the body's resources to be able to be marshaled where they're needed efficiently. If you have too many fights going on in the body all over the place, then the body doesn't have enough energy to get where it's really focused and needed. So I usually aim for intensity. And I've compared all kinds of devices, and that I look at price, I look at convenience and ease of use. And so my book, Supercharge Your Health, has tables that tells if you want to treat locally, do you want to do mild, do you want to do moderate, do you want to do strong? You have to treat regionally, so you have to treat a chest or a belly. Then do you again, weak magnetic fields, medium or strong? If I'm going to treat a belly, unless I'm treating the skin on the belly, that's a big area to have to go into. It's not only deep, it's also wide. So you want to get the whole belly, then you're going to need a stronger magnetic field. And so typically we're talking, I would say a minimum of about 5,000 dose. If you're doing a device that only delivers 2,000 dose, you're going to get some benefit, but it's going to take you a lot more time. You have to do a lot more treatment time to get enough benefit, and quickly enough at that. So when you go to a doctor's office, if a doctor has a machine, they usually have a very expensive machine that's high intensity, so you can feel it right away. You get the results right away because you're paying by the minute to be in that doctor's office to get treatment, right? So you need to notice that it's doing something, and you need to get results quickly. But you can't just do a 5-minute treatment or a 10-minute treatment and get results, because healing takes time, and you need multiple treatments to do the job. We know that with physical therapy, right? We know that with sports training, athletic training. You're not going to get off the couch and run a marathon just by doing a few jumps and
oh no,
right, and using a rope, skipping rope. That's not going to be enough. You're going to have to train for weeks and increase and increase and increase and increase, so that you could eventually get to the goal that you're trying to. So we have to know the body, we have to know the pathology, we have to know the depth that we're trying to treat, and exactly what we're treating. And once you understand that, then you have a better sense of the parameters you have. So the book, Supercharge Your Health, has, I review 80 different health conditions. And I provide a recommendation and a protocol for those 80 conditions. And I also recommend supplements.
It's so good because you have there's thousands and thousands of articles out there on PEMF, it seems like, and definitely some better than others, but there's a lot of misinformation, I think, out there, and having a protocol that you can refer to, and one that's, maybe disease or illness specific. And, I think it's just such a useful piece of information, because it is confusing. It's interesting. In Lyme, for Lyme, to me, again, it's a system thing, just like you said. It's certainly a place where you see, lots and lots of different things going down, and people are reducing it down to certain symptoms and taking things to treat it, which I find is kind of like whack-a-mole a lot of times, and we're not getting there. But of all the symptoms that you hear from the, all those patients over the last, 30 some years or whatever, what are the ones that, Lyme, that PEMF in Lyme and co-infections, mold toxicity, are there any ones that really jump out as ones that PEMF is they might notice sooner than just like, hey, I got to train for 5 months or 6 months on my mat before I see it?
I think that's a good question, and a very important one. The most common use of PEMF therapy is for pain. Now, we're not just talking about Tylenol for pain. We're talking about not only Tylenol, so that's important, maybe not to use something that reduces the pain right away, but the goal is to heal the cause.
Mm-hmm.
If you can't heal the cause, then you're going to be relying on something just to numb pain for the rest of your life. I call it numbing and dumbing. Right? That's what we typically do. But we're trying to heal the problem. So you get some pain relief very quickly with PEMF therapy, but it's going to come back unless you actually heal the cause. And the healing the cause takes time. So I describe PEMF therapy as basically three phases: physiologic response, functional improvement, and healing. Healing is part of all three of those, right? And functional improvement is even more related to healing than a physiologic response. So physiologic response is improving circulation.
Mm-hmm.
A physiologic response is reducing inflammation. A physiologic response is let's say, well, it's not stem cells, it's basically a healing response. So decreasing inflammation, improving circulation, and pain reduction. Those are physiologic responses that happen fairly quickly. After that, then we go into functional changes, which relates to healing and maintaining a physiologic response so that it doesn't sort of back off. So if you keep doing the therapy, that physiologic benefit, that functional benefit begins to stay. It now begins to last. It doesn't regress. But that all depends on healing. So even though you're done, even though your tennis elbow is gone, have you healed the tissues?
Right.
Right? You've taken care of what you sense, and what we sense is actually pretty numb. It's pretty dumb, actually. We're not that sensitive. Right? Our nervous system has to have a signal get to a certain level for us to even notice it. And before it even gets to that level, that tennis elbow has been brewing for quite a while, until finally it gets to a point where it says, ouch. So when you're done with the ouch, you're not done yet. And I had a perfect example of this. I had a hockey goalie who lost his scholarship, his university scholarship, because he got a groin injury. He did the usual things for about 2 years: physical therapy, all kinds of devices, and so on. I got him a magnetic system like the one you have there. He wore it constantly, continuously. So literally within 2 weeks, gone. After 2 years of fighting with all this, pain was gone. So what did he do? Being a young guy,
Stop using it.
no.
No.
He kept using it. But what he did, though, is he started working out way too much,
Oh.
because now he was pain-free. So without understanding pathophysiology and healing responses, he overdid it too soon, too fast. Right? And so basically he re-injured.
Your body was designed to heal, but illness, chronic disease, stress, injury, and time can slow that process down. What if you could restore your body's natural ability to recover, recharge, and feel its best? The key to healing is giving your body the energy to repair itself. PEMF therapy does exactly that, recharging your cells, improving circulation, reducing inflammation, and helping you function at your best. For decades, I've studied this technology, worked with hundreds of medical professionals, and helped thousands of people reduce pain, regain energy, and take control of their health. However, not all PEMF devices are created equal. No one size fits all. We offer personalized consultations so you can find the right device for your needs, backed by real science and trusted results. If you're ready for a real solution, let's talk. Schedule a consultation at drpawluk.com. That's drpawluk.com, because real healing starts at the cellular level.
Right. And I think that this is such an important piece of the stages of healing through this PEMF protocol, because this is what we run into with our chronically ill patients forever. It's like they just want to get a little relief, and then they get the relief and it's like, oh, that means I can go, or I can crank up my protocol. And so, I mean, I love talking about the functional improvement and then the healing response, because it's so critical. It's not just, it is a longer play, because, and you're that important, right? To be able to heal. And I always tell people when they go back, do about 70% of what you think you can do, and probably even 50%, because you're going to overdo it. But we want to do that. And one of the things so interesting, Bill, is like, we're talking about circulation and inflammation. These are things that everybody talks about in chronic illness. We bring down that inflammation, we want to improve our circulation, so maybe our Raynaud's goes down, but also we want to be able to get to these small micro areas that all these organisms are hiding and have messed up. And we've got, functional hypercoagulability and blah, blah, blah. But one of the things I find interesting about PEMFs is, and kind of the question has to do with, we know in Lyme disease that not only are we trying to improve circulation and get rid of inflammation, obviously, but we're looking at things like biofilms. We're looking at persister forms of these organizations. There you go, organisms. And then also, even antibiotic and herbal resistance. I mean, is there any work that you know of that's been done with PEMFs that kind of can support us in this area of persisters, biofilms, even antibiotic resistance?
Well, and I was not all that familiar with biofilms and Lyme disease. I just read a couple of articles about this. In fact, that there's a skin infection. You can get like a granuloma kind of infection from Lyme disease in the skin.
Mm-hmm.
And you can't eradicate it because it's resistant to antibiotics. So the biofilm then basically creates a microcosm of an environment where you can't even culture the Borrelia out of that lesion because it's encysted, it's dormant. And you try to culture it, it doesn't culture, but it's resistant to antibiotics. In other words, it's not going to heal because you can't get rid of it. It turns out that PEMF therapy is actually very, very important for biofilm reduction. Now, is it the only thing? I think you should still do enzymes. You should still do anti-inflammatories. You should do all the normal things that we would do. But now activating the treatment with the biofilm, with magnetic field therapy, because the magnetic fields go right through the biofilm. Mm. And it turns out that the magnetic fields help the body by itself to fight infections. Things called nets, traps, net traps, right? So basically the neutrophils that trap bugs or traps infections or pathogens. So they actually put out like a fibrous network into the surrounding tissue where the pathogens are in that tissue, and they trap them. So that's why they're called traps. Well, PEMFs increase those trap functions. And they also decrease motility of the organisms in the body. So, and inside a biofilm, what do you have? You don't just have Lyme. You have a whole lot of stuff in those biofilms.
Right.
And they're all talking to each other, and they're sharing genetic information on how to resist. So magnetic field therapy then allows access to that biofilm with antibiotics, with natural antibiotics, with medication. So I know I've had experience, you've had it, I'm sure as well. People get months and months of IV antibiotics, and they just don't get better. Even with IV antibiotics, which should penetrate the biofilms, but they don't. So now magnetic field therapy is going to activate all of this and make them work synergistically together to get a much more effective response and much, much faster.
Well, I think that's kind of the holy grail. How do we get in there and use everything together synergistically, and a lot of it is, I love the word you use, activating, because that's what it feels like to me. And, when we have people, it's like they're doing all the right stuff, but maybe they don't have the juice, or maybe they don't have the right activation. They can't get in. And I think that that's a critical component. I guess one other question too is like, and this is sort of like the Pandora's box of questions, but it's like PEMFs and mitochondrial function.
Well, again, since PEMF therapy penetrates cells completely, totally, it activates mitochondria. So it increases mitophagy. It increases autophagy, and it stimulates the whole ATP cycle. So magnetic field therapy, so ATP by itself, adenosine triphosphate, is the energy molecule of the body, right? It's produced by mitochondria. So mitochondria that are poisoned or dysfunctional can't make ATP, can't make enough ATP to respond to the demand for ATP. Any inflammation is an ATP hog. It just starved for ATP. So magnetic fields increase the production of ATP from ADP, but ATP by itself is not useful. Right. It's a supply. In order to release the energy from ATP, you have to strip off one of the phosphates, and that's done using enzymes, right? In the cells and in the membranes of the cells. And so magnetic field therapy not only increases the production of ATP, it hydrolyzes the ATP with ATPases, enzymes. So it strips off one of the phosphates and then recycles it again. So magnetic field therapy is constantly helping the body to recycle ATP. But there's a problem. ATP is used up extraordinarily rapidly. Every beat of the heart basically uses up the ATP that's available at that moment. So if your heart rate's going too fast, you can't produce enough ATP. Right? So magnetic field therapy augments the production of ATP even in a starving heart. Not only starving for circulation, but damaged by inflammation, decreased perfusion, and decreased mitochondrial function and ATP production. So that it augments the value of the heart. I have a blog on my website about heart failure. And when I was doing the research to produce that blog, I was just blown away by the complexity of heart failure and how it turns out that magnetic field therapy basically helps with virtually all the components of heart failure. Again, magic.
Well, it can be viewed as magic when we don't know what those parts are. And like the part I love, like I loved asking the question about mitochondria, because for me, one of the other pieces that we're always looking for is how to clean up those cells that you talked about, how to, get mitophagy to occur. How do we promote autophagy, clean up inside of the cells? And a lot of these organisms we're all dealing with are intracellular pathogens that the cells are just kind of like not working optimally. So they're just leaving them there. So anytime we can get the cells to kind of take out the dirty laundry, so to speak, makes such a big difference. And then to your point about the magic, I always ask, I tell everyone who's viewing, we ask like folks to just give us a couple questions to help let us know what they think is important about their topic. And then I get to, do my own research and come up with my own questions. But you're one of the people I love when you send things in, because one of your questions that you shared with me is, can PEMFs raise the dead? So I'm assuming that I can't wait to hear what this is about, but also I'm assuming this has to do something with the magical components of PEMF.
Well, no, I have a disclaimer. PEMF therapies do not raise the dead, but there's two kinds of dead.
Right?
Right? There's a dead, and there's a living dead.
Yep.
And we're not just talking about dead, the whole body being dead. We're talking about cells and tissues at different stages of destruction, of immolation, of breakdown, of dysfunction. And so that's the living dead. So right next to, if you cut yourself or burn yourself, that tissue is dead. Where you cut through that tissue is dead. Now the tissue around it is damaged, but not dead. And if it's not treated correctly, if you're not given the proper support, it will die too. So what you have to do is support the living dead or the near dead, right? So magnetic field therapy definitely raises the near dead or the living, the dead that has the chance to revive.
And, as you look at the whole system though, as you've been talking, it's like so many, I'm just thinking like, wow, so many people I talk to and work with on a daily basis, like they probably wouldn't come in and say, I feel like the living dead. But if you asked them, most of them would say, yeah, a lot of times they do. In fact, I talked to someone earlier today. She's like, look, for the past 4 months, I literally thought I was going to die. Like it just got so intense. And, she knows the symptoms she's experiencing are not life-threatening, but they suck, and you walk around feeling like
they make you depressed and they make you wish you were dead.
Exactly. So I really like that analogy and the cut is really important because it's like, this is one of the things I tell people all the time. If you want to know how to get better from Lyme, please work with a highly trained expert, not someone who, if you're sick for more than just a little bit, don't just start with a newbie. Let's get with someone who has experience in this. And if not, like we even have our Lyme practitioner training certification program and our mentorship in case you're new, but you want to have backup. And this is one of the things where if you're going to go buy a PEMF device, if there's different costs, there's different intensities. Often you get what you pay for. Often the high price tag doesn't mean you're getting what you pay for. That's why I always highly recommend someone to reach out and work with someone like you. Because if I have a question, I'm calling you. I can do some research, but it's not it's not like, the thing I do day in and day out is research PEMF. And I just think the point about understanding what's alive and what's on its way out or on its way back in, depending upon how we support it in the body, you need a team who's actually studied that to really know that. And so I just think it's just a great highlight of why people should be, reaching out and asking for the support. So, because, I have a couple PEMF devices. They're purchased for different reasons, especially like the one that I can travel with, but man, you can waste a ton of time and money. So if someone's looking, I appreciate so much you sharing all this information. It sounds like we could go on all night about this, but most importantly, if someone wants to get that support with PEMF therapy, what maybe is the best for their condition? What is maybe the best for their financial situation? And maybe they need even more than that. I don't know. I mean, where can they find out about the work that you're doing so they can get the actual right support?
Talk about confusion. So my website is totally loaded with information, and it's overwhelming. It doesn't give you a specific recommendation for a specific problem, maybe not the variations of Lyme disease. So we can talk about Lyme disease, but then we have to talk about your particular aspects of your Lyme disease, not to mention you, because you brought yourself into Lyme disease, right? Sort of.
Yeah, like you were alive and then you got Lyme disease,
You were alive and you had all these other things going on as well, right?
Right.
So now you have Lyme disease layer on something else. So I recommend getting my book, Supercharge Your Health. Supercharge Your Health with PEMF therapy. So that's a $29 investment. If you're going to spend $5,000 or $10,000 for a PEMF device, or even $2,000 for a PEMF device, $29 is well worth it. And that goes through a lot of protocols and it gives you a lot of ideas. Now, it's still not necessarily enough for you. It's not, how do I do this today? How do I do it tomorrow? How do I do it the day after? So for that purpose, we offer consultations. So on my website, drpawluk.com, you go to the homepage, and then on the right side of the homepage, you'll see consultation, request a consultation. You click on that, and it'll give you a form to fill out. Fill out the form, and then apply for a consultation. Now, if you're looking to not have to do any work, if you're looking to just give it a magic bullet, a pill, and that's it, you want to be done, PEMF therapy is not for you, because you have to use it. You have to apply it. You have to work at it, just like you do anything else to have adequate results. Mm-hmm. And beyond that, the combination of those two things. Now, the website, again, has a lot more blogs on individual topics, and it gives you some basic information on how PEMF therapy can help that particular condition. But it's still not the answer. It's the solution for you. So the consultations do two things. We get to know you and what you're aiming to do. But we want you to be prepared. Don't waste a precious half hour of a free consultation if you don't prepare yourself. So we recommend certain things that should be watched or read before you even come to the consultation. And having the book would be a big help. Not necessary, but it would be a big help. And then with the consultation, once we get to know you, then we say, okay, here's your conditions, here's what you can expect, and here's the device that's probably going to get you the best answer. Now, if you're expecting to solve your problem for a $50 device, Lyme disease is not a $50 solution.
Right.
Right. It's a lifetime commitment.
Well, and I think that one of the things I really like about the PEMF devices is they are kind of lifetime purchases as well. And, that's the thing, you take care of them. And I one of my goals, Bill, has always been not to be the doctor who treats chronic illness, but that the person that helps people be chronically well, so that they can go out and shine their light, so that they can go do whatever it is they're passionate about. And the thing I love about PEMF is wherever you're at, it can support you getting to the next level. And then once you're there, you can use it to help maintain yourself, like you were saying, along the way. And that's one of the most important parts. And I think about your blog to me is inspirational. And if I need to find and for me, somebody's asking me a question, and do I refer them to you, or do they even want to go down PEMF right now? Maybe it's for a condition for a friend that might not be the expert. That's where I can go get a quick look. But I also have, decades of experience in being trained in how to read research, so I can take your, and I also know you, so I know the quality. But the blog to me is like a quick informational piece, and it's a place of inspiration, and it allows me to know the possibility. And then your book is kind of like the DIY version, or just getting to know it a little bit more. But I think the consultation part is which separates you from so many other people. And that's really like what I love about my job, is being able to dive in with that individual and find out what their goals are so that you can match their goals and their lifestyle with the proper device. Because as you said, it's something you need to use on a regular basis if you want to get the results. And to me, the other part about PEMF, I'd be remiss if I didn't say, is it's freaking easy. I mean, a lot of times
Really,
you put it like
fundamentally.
I walk around, you can put it in your pocket, you can lay on it, whatever, depending upon your device. And yes, you have to commit to the time, but if you're going to do this, you're so worth it, right? I mean, the people we're working with deserve health, and to optimize it. And to me, it's just one of this hidden secrets. And I think that it's also a place that other people recognize our hidden secrets. And there's a lot of baloney out there. And I feel free to say that because I've talked to a lot of people about it. So I would just say to everyone,
and that's a point I want to address. In fact, that's a really critical point. There are lots of multi-level marketing companies out there that are selling PEMF devices. There's a lot of pressure, and they sell you a great story, but they're not doctors, they're salespeople. And they're totally trained on that machine. So they don't know much else. So because I mentioned intensity is really, really important, intensity matters. If they don't tell you, if they cannot tell you what the intensity of their machine is, why would you buy it? Why would you buy a car when you don't even know if it has an engine or what the horsepower is? Right? I mean, you got to know what you're buying. And they won't tell you because they don't want to talk about that, because that's not important to them. What's important to them is frequency, and it's been around 25 years and it improves circulation. But what else does it do? Does it get deep into the body?
Right.
It doesn't get deep into the body, especially if we have Lyme disease. Forget about it.
Well, and I'm glad you say it that way, because there's my mom, actually, I know one of the devices I'm assuming you're talking about, and my mom's retirement community a couple of years back, everybody's getting it. It's curing everything, including their wallet and their savings. It's like, guys, like, there's nothing wrong with multi-level marketing done well. I have personally not seen a multi-level marketing PEMF device that I would personally purchase or use in my family. And if you need me to say anything else after that, you probably aren't paying attention.
Totally agree with you. So the key is most of these devices are less than 1 Gauss. I have a device that I introduced into the market to compete with these other machines that are only 1 Gauss or less. And they're $5,000 or $6,000. So we created a machine called the BioBalance, which is 10 Gauss. So it's 10 times stronger than those other machines, and it's $3,500. Still not cheap, but they're $6,000 for 1 Gauss, and this is at least 10 times more than that. It's still not good enough most of the time. It's not adequate for health maintenance. Okay, but not for healing.
Right, and I think that's the point about getting a consultation. If you're going to invest in something like this, just invest in the right stuff. I mean, all of us have bought things that we don't really use, or we liked it in the store and we do it for a little while, but
or it sounded good.
Yes, it sounded great, right? But like you said, Bill, there's professional sales and marketing, and then you have people like us. Like, people can say whatever they want about what I charge and what I do, but I'm going to sit down and have an honest to God conversation just like this, where it's no holds barred. We're just going to be on point, and we're focused on helping you achieve your health goals, not helping us achieve our sales goals. There's plenty of people that we need to serve. And like, my point here is not to belabor this point, but there's so many damn gadgets that people are buying and wasting their damn money on. And I just want you to stop wasting your money and invest it in things that actually are going to move the needle forward for you. This is the reason that we've done this summit. We're not partnering with people. We're not bringing on speakers who are full of crap. These are all people who are vetted, things that, that we know that we're using, because in my lifetime, I've had to treat myself. I try not to say lost, because I learned a lot during those 13 years, But I got a little sidetracked for 13 years, and everybody knows I'm always trying to have the positive mindset, but man, it sucks. You can even see I kind of get a little choked up saying it. But then my daughter was sick. She got bit by a tick and had acute babesia, was sick for 3 weeks while I let everybody else try to do it because you're not supposed to doctor your own kid. And then I just had to take over and do it. But she was fixed in a couple of days with the acute issue. I treated her for another 6 months, like straight up antibiotics and herbs, then herbs for another 6 months. And she's on PEMF and a lot of the other therapies that we've talked about on a regular basis because she's my kid and she means that much. So the reason I wanted to sit down with Dr. Pawluk today and bring this conversation to you is this is an area where you can get amazing benefit, but you can also go to the cleaners. And I'm sick and tired of everybody who's out there charlatanizing this field. Too many people are suffering. Too many people are getting the wrong information, and slick sales stuff, it has no place here. I can tell you the truth and you can buy or not buy. It doesn't matter. But let's really tell the truth. So Bill, I just want to say thank you from the bottom of my heart for showing up and talking about the research, sharing the truth, and diving into these devices like no one I've ever met. I mean, I'm at all these conferences. I go down every rabbit hole with every stinking device because if I don't, my patients are going to ask. Right. I've never seen anyone who's put so much time and so much care into putting together what PEMF can be and should be. And I just want to say thanks as a patient, as well as a practitioner and a father.
Thank you for that as well. We both share the same heart. I tell people that I'm not your doctor. You're your doctor. I'm your consultant. You have to doctor yourself. I can make recommendations to you, but if you don't follow them, then, doctor thyself.
There you go. Well, everyone, I want to say thank you for joining us for this episode of the Healing from Lyme Summit. I'm sure you can tell how fired up I get about this and why I brought Dr. Bill Pawluk on here, because he's the same way. We, just so into making sure that you get the right information in this incredibly important field. And it's an area of healing that, like he said earlier, can activate, can really activate your self-healing mechanism when done well. So definitely check out drpawluk.com. As always, we'll make sure we have everything in the on the Summit resource page, point and click, and then you can go over and talk to Bill or somebody on his team. Definitely pick up his book. Dr. Pawluk, thanks for joining us. This has been such an amazing pleasure.
Dr. Moorcroft, my pleasure. And may we do it again.
Absolutely. And everyone, thank you for joining us for this episode of the Healing from Lyme Disease Summit. Again, we're here to help you learn more about the options that are out there and then connect you maybe with some of the people who can help you figure out what the next best step for you is, and give you ideas to your practitioner in your area. So even if you've got a great practitioner in your area, maybe they don't know as much about, PEMF, definitely have them reach out to Dr. Pawluk as well, because I learned so much from talking with them, and we're really here to share information because there's too many people suffering. And at this point, we know there's several million people with post-treatment Lyme, chronic Lyme disease. And so we need to get more practitioners in our mentorship programs being trained by the likes of Dr. Pawluk, having his book on their shelves. So thank you very much for being here, and we'll see you in our next episode.
Thanks for joining me on the PEMF Effect. I hope today's conversation gave you new tools, insights, and inspiration to take control of your health. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who could benefit from PEMF therapy and holistic healing. Your body has the power to repair, recover, and thrive. Sometimes it just needs the right charge. Until next time, stay curious, stay proactive, and keep powering up to better health.